So here in the United States, we have an unfortunate situation. Almost everybody has health insurance and they want to utilize that health insurance. But unfortunately, in recent years, health insurance value has gone down with the prices going up. And patients that come into my clinic think, hey, I have health insurance, they're going to pay for everything. That is not the case, which is why I recommend most people start cash paying practices. Dealing with insurance is incredibly difficult. You have things called pre-authorizations that you have to call and monitor. And then you have to be on the phone for hours at a time trying to get certain things approved through insurance. On top of that, you have to go through a credentialing process. Means you have to go to the insurance company. You have to tell them who you are. You got to tell them your experience. It just goes on and on and on. You have to fill out applications. And that's just not one insurance company. You got to do it for all of the insurance companies. And it takes painstakingly effort on the administrative level to get that done. Every month I have an insurance company that needs me to recertify because I'm contracted with all these agencies. Oh, I forgot to mention the contracting. When you contract with an insurance agency, what do? They tell you, we're going to pay you this much and you can't go above or below that. You're going to get this much and that's it. For all of those reasons, I don't recommend you try to get into the insurance game. It's really, really hard. So how do you deal with that with a patient that has insurance? So let's say you have like a wellness practice, or maybe you're doing weight loss management or things of that nature where patients want to utilize their benefits. Let's use GLP-1s, for example. GLP-1s are mainstream now. Over 500,000 Americans are using them, and they want their insurance to pay for them. Unfortunately, you have to go through a pre-authorization process for that. You have to meet certain criteria. So they have to meet with the provider. The provider has to document that they've tried all sorts of other things for weight loss. Then they have to, call their insurance company, send over documents, send over forms, ask, beg, borrow, and steal, trying to get the insurance company to say, yay, go for it. And you're like, great, your insurance is covering it. Now the patient thinks, oh, my insurance has approved it. I don't have to pay for it. Wrong. Now they have to meet their deductible. Right? The deductible might be 1,000, 2,000, 4,000, who knows? Well, use like Ozempic for an example. You could be paying around $1,000 a month for that medication. And the patient's now confused why they have to pay $1,000 a month for their medication because their insurance is covering it. Then they meet their deductible. Now they have to do what's called an 80-20 split, where 20% of the cost is covered by the patient, 80% is covered by the insurance company until they get to something called an out-of-pocket maximum. And that out-of-pocket maximum could be double their deductible. So they might never get to where the insurance is covering 100% of their treatment. And it's incredibly frustrating for you as the provider to, explain the system, how the system works to your patient. I had those conversations all the time because in my practice, I do have some contracts with some insurance companies. And frankly, I'm over it. Okay. I've now whittled away the services that those insurance companies do. I'm down to one insurance based program in my practice, which is Botox for migraines. And the administrative burden on that is making me want to get rid of that as well. So probably in the next year, I'm getting out of the insurance game 100% completely. It costs you a lot of money. It's painstakingly slow. And you can't do what you want to do. You have to rely on a third party telling you what to do. So how do you solve that? Go cash pay. As long as you have a license and malpractice insurance, you can go and do whatever you want to do. Okay. And then what I do with patients that are like, I'd rather, have my insurance take this. I explain very quickly, hey, this is what's going to happen. We got to meet your deductible. Then we got to meet your out-of-pocket maximum. And regardless if you go through insurance, you're still going to have to write the checks. So let me do it on cash pay. I can bring my prices down, which helps you out in the long haul. Yes, we won't be hitting your deductible, but your out-of-pocket is going to be much less by allowing me to do cash pay. And when you have those conversations with your patients, it goes much, much better. And it helps them understand how a cash pay can actually save them money in the long run. Another thing you can do for anybody who has objections to paying cash is you can get them onto a payment plan. You could do in-office payment plans. I don't necessarily recommend those because you're the last one to get paid every month. If something happens, the medical providers are always the last one to get paid. And also when people are paying for something after the fact, there's a little bit of negativity like, I still got to pay for this thing, right? So what I do is I use third-party vendors to get a payment plan going. That way they deal with a third-party vendor. I have to pay a small percentage to them of the case fee, but they take care of all of the collections and stuff, and they write me a check immediately. And I'll be frank with you, paying 3 to 5% for that administrative fee is well worth it in that you don't have to go and chase down the money. So that's a really brief rundown on insurance and cash pay. Hope that helps you in your practice.